Thank you, David. Okay, good morning. I'm Laura Shaughnessy. I serve as chair of the Professional Counselor Advisory Committee for the Kansas Behavioral Sciences Regulatory Board. I ask that the members of the advisory committee respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Jim Kilmartin.
Present.
Good morning.
Good morning.
Good morning. Harriet Bachner. Here. Good morning. Melissa Briggs.
Present.
Thank you. Good morning. Michael Countryman.
Here.
Thank you. Good morning. Acha Goris.
Present.
Good morning. Thank you. Bob Kircher said he will be here in a little while, as well as Vanessa Perez. And we had Andrew Secor and Adil Torres Rivera say they will not be at the meeting. I note the following BSRB staff members are also present: David Fye and Leslie Allen. And do we have counsel here? I don't know.
No, legal counsel can attend if we invite them, but generally they're not in attendance.
Okay, just wanted to make sure I didn't miss them. Next, David Fye will read a message concerning this meeting being held remotely.
This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or COMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment to contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting to ensure that all items on the agenda are covered. Because we are conducting this public meeting remotely by conference call and other teleconference ability, we'll state for the record the following information. Public access to this meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of COMA are not suspended, so we will be conducting this meeting pursuant to the COMA. On August 30th, 2023, we sent notice of the advisory committee meeting to all individuals who had requested notice of advisory committee meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting material have been posted on the board's website and are available for review. And any individuals wishing to receive a copy of the agenda specifically could send an email to david.fye@ks.gov with a subject line request for the agenda, and it will be sent to them. The notice contains information for the conference call and YouTube channel that allows members to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, they may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting is available on the BSRB YouTube channel following the conclusion of the meeting and can be accessed by using the link to the meeting on the agenda. And the conference call line is active. I did check it before we started the meeting, and no individuals are on the conference call line.
Thank you, David. The meeting is now called to order. The advisory committee will begin discussion of our agenda items. The first thing we have, of course, is agenda approval. You've all received the agenda. Does anybody have anything they need to add, and if not, I need a motion to approve the agenda.
I move we approve.
I need a second. Thank you, Jim.
Second.
Thank you so much. Wait a minute, who did that?
As Michael.
Thank you, Michael. Michael Countryman approved, seconded. All in favor, say aye.
Aye.
All opposed, say nay. Okay, the agenda is approved.
Hey, Laura, quick question.
Yeah.
Is everybody seeing the ability on their screen to split the view so we can bring up the documents side by side? Because for some reason in this meeting, it's not appearing for me.
And I'm not sure about bringing up the documents side by side. When we talk about certain regulations, I'm happy to share my screen and we can pull those up.
Okay, no, usually the iPad has the capability of splitting the views, so I can look at the conference over here and I can look at the documents on the other side while I'm paying attention. But now I got to get another device, so I'll be back.
Thank you.
And I don't think we've made any changes behind the scenes, so there might have been an update, but I'll look into that more between now and the next meeting and see if we need to adjust something.
Okay.
Thank you for that. You've recently received the minutes. Has anybody had any time to look at the minutes and bring us any questions about them? Any questions?
No questions.
Okay, then I need a motion to approve the minutes from the August 7th Advisory Committee meeting.
So moved.
Thank you, Jim. And I need a second. Okay, and that's Acha. Acha approved it. He seconded it. All in favor of adopting those minutes, please say aye.
Aye.
Thank you. See a lot of hands. Any opposed, same sign. Okay, the minutes have been approved. Yeah, thank you for that. And we will move on to the executive director's report.
Thank you, Laura. And I'll start with some updates on operations, and then I'll talk a little bit about some updates from the past board meeting, and then just some general updates. In terms of operations, last time I believe I talked to you, we had just passed a little bit past the beginning of the fiscal year, and in conjunction with the bill that passed, Senate Bill 131, the BSRB received authority to hire 2 new licensing specialists. So we've been in the process over the last few months of hiring, and then when we made those hires, it opened up additional positions. And so happy to report that we are now fully staffed and everyone is here in their positions. We have 2 new employees for the BSRB. Their names are Lois and Rhonda. So if you call our office and you have 2 more people that you are speaking with, I just want to let you know that they are on staff now and helping us out with licensing responsibilities and some clerical responsibilities. And we have 2 other members of our staff who were previously in different roles who are now filling those licensing specialist positions. So really excited about that. Part of it was that staff members we had on board wanted to challenge themselves to take on additional responsibilities, and happy to see staff members challenge themselves and grow, and looking forward to continuing to work with all of them as we work to make implementation of a lot of the new items from that bill, and then also work on our internal processes and try to make sure that we can issue license even more quickly. In terms of our operations further, I did want to let you know to implement some of those items in the bill, there is a fee attached to some of those new license types that are being issued. You may have received an email from, or actually, an email from me that included a PDF letter. And it's also posted on our website for the agency, but it included about a 5-page summary of all the different items that were included in that bill that passed. And really excited about all those new license types. I think they will resolve a number of issues, add some additional flexibilities for individuals to be able to get licensed sooner or continue to hold their license, not let it expire, or for individuals who wish to come back and practice again. So really excited about that. We have rolled out all of the different items that were mentioned in the bill. Initially, we were able to move forward on most of the items, and then we had another update we posted, I think, back in August for some additional items. And so it's a little bit of a juggling, but we're doing well, I think, implementing those. There's also some changes to our internal process. So for new applicants, within 15 days if they apply, they receive a message from us letting them know sort of a preliminary review of what information we've received to that point. Trying to help them know if they have a complete application or if it's incomplete, and if it's incomplete, what else is missing for it to be complete. And so we are trying to make sure there's good customer service between our agency and members of the public. Trying to make sure that we are helping people bring them in a little bit more to the license process, so that when there are unique cases that require some additional investigation, when there are items that require us to reach back out to the schools to gather information, that we're trying to link in those applicants a little bit more and to make it a process where we can work with them and hopefully get that information in a smoother process. And so that way it can make the overall licensure process a little more quick as well. So we have put in that capacity, and we're working on tracking those 15-day letters. We're also trying to look at all of our license processes. So when we have told people, historically, that when we have information that we receive, they should allow between 30 to 45 days after we receive a complete application for us to make a decision based on the thousands of individuals that we are helping at any given time. We are working to reduce that time down to 30 days and track to make sure that we are keeping a good watch over those applications. And if there are information that is needed, we can get that quicker. If there is information that we have, we can make a decision, and we'll move faster on that too. So those are priorities we're working on, and trying to make sure that we have good tracking tools with that as well. I mentioned the fees that go in conjunction with some of those new license types. We did attend a meeting with the legislature. It's the Joint Committee on Administrative Rules and Regulations, or JCAR. And they asked me a series of questions about those different licenses, and I answered the best that I could. Some of those are a little unknown in terms of the impact. The legislature did add some language to have the board come up with regulations for an expedited application process and the ability to charge a fee for that. The board has talked about that a few times, and we've worked with board members on some draft language for that. So it is moving forward, but it's unclear at this point how popular that's going to be or how many people that would actually apply to. So at this point, that's one of those variables. It's hard to predict. But the other items, we think it will present mostly some alternatives to existing items or some ways to help people stay licensed. And so we think the result will be positive, but it may not have a significant financial impact on the agency one way or another. In terms of the fees, there is a requirement that those are pulled open for 60 days for the agency to receive public comment. Those have been posted on our website, and they were published in the Secretary of State's publication, the Kansas Register, about 2 months ago. We have a public meeting set up for tomorrow, Tuesday, October 3rd, at the BSRB office. It is from 10 a.m. until 11 a.m. And that is an opportunity for any individuals from the public who wish to come and share any public comment with us, and they're welcome to do so. It's a requirement as part of the process, and so we always have when we have changes to regulations. But in
I forgot. I canceled our flights.
sorry, Jim, I think I'm getting some background. I'll go ahead and mute Jim before he comes back. Yeah, so as part of that process with the open meeting on the regulations, any individuals who wish to come to that meeting, provide public comment to us, are welcome to do that during that time period. And that notice has been posted, like I said, in the Secretary of State's publication, also on our website. But that's not the only way to provide public comment. Any individuals who wish to send it by email, there's instructions in those notices. They can also send that to me directly and send me those comments. And so we'll collect those, share them with the board, and then ultimately the board will have the ability to take a roll call vote to adopt new regulations or to make further proposed changes. And then those regulations will need to be published back in the Kansas Register. And then I believe after about 10 days or so after a publication, they become effective. But as a stopgap measure, we did go ahead and get temporary regulations put in place, and that allowed us to move as quickly as we did to implement some of those things. Normally there's a set of dominoes that have to fall, but one of the items the board did is they voted to reduce certain fees for temporary licenses for some of the professions so that they would all be at $50. And so that was something we wanted to move ahead on as quickly as we could. And so that's part of the reason why we received the authority to do temporary regulations. And then once we have the permanent regulations, those will replace the temporary regulations. So moving forward on those items. If you are curious about any of those items that are included in Senate Bill 131, you can see those on item by item basis. If you go to our website and look under forms, you'll see all the new different types of licenses, but also those notices are still on the front page of the website, so you can see those notices as well. In terms of a couple other items, I'll be attending an IT summit. Coming up here, the governor's office is putting on sort of a one-day short summit for different representatives from different agencies to get a little more IT training in terms of how to interact with other representatives from state agencies. If there is an issue that comes up, there's an interactive drill. It's a good exercise. They do it once a year. That'll be something I'll be attending on behalf of the agency. And also the governor recently did an executive order asking all agencies and directing them to put in place a very organized continuity of operations plan for and so a lot of agencies are working on that. We've been meeting with representatives from the Department of Emergency Management to put that into place. And so that is moving forward. The goal is to have that finalized by the end of the calendar year. So we're on pace for that. And then there is a change in vendor for state agency websites. So we've been having some meetings with representatives from the Office of Administrative Technology Services, OITS. And I think at least within the next year, the BSRB will have a different website. It should look a little different. We're trying to work with those vendors to make sure that we don't lose any of the functionality we have. We talk with them about, some of the things we really like about our website is that we try to present information in a clear way. We try to make sure we can post a lot of information in a timely way for the public to be able to access, and we don't want to confuse them by making wholesale changes. So really focused on making sure that information is available and accessible. But it should look a little different sometime next year, and there'll be more updates as we move closer to that. In terms of some items from the next board meeting or from the previous board meeting, the board did meet on September 11th, and there was a new board member that was appointed to the board. Her name is Jill Flessing, and she is the board member for addiction counseling, and she has the role that was previously held by Deb Stidham on the board. In terms of some other items the board discussed, one item that a lot of the advisory committees have previously weighed in on has to do with the requirements for individuals seeking clinical licensure, and a current requirement and regulation that says all changes to those approved training plans have to be submitted to the board for approval, and that they have to be turned in within 45 days. If you fail to submit a change within 45 days, then hours you accrue after that point will not be counted. And so the board has had some discussions about, is that the most effective item to keep in place? Are there alternatives that will still accomplish the same goal? And so the board had further conversations on that point and collected a lot of the feedback from the advisory committees. But when we talk about that item a little bit later in this meeting, I'll share some items that board members discussed. They kind of, and also that I discussed on behalf of our staff as well, because part of it comes down to wanting to have something that'll be helpful for licensees and the rest of the public. But then we also want to make sure that we have a standard that is going to be easy to understand, and something we can enforce consistently between individuals, and also something that would be helpful and not overly burdensome. And so, so there's a new approach that I'm going to share with you, and just want to collect some of your comments and feedback on that possible new approach to that rule. Additionally, there was a discussion about other licensees from different professions serving as the supervisors for certain professions. For example, for marriage and family therapy and professional counseling, there is a regulation that says individuals from other professions can serve as supervisors if certain requirements are met. And part of that requirement talks about extenuating circumstances, and there is an official definition of extenuating circumstances. So there was a discussion about that, and I believe your advisory committee had weighed in on that before. And when it went back to the board, the marriage and family therapy chair had weighed in on behalf of that advisory committee as well. And it kind of brought a big question, which is one of the items on the agenda as well. And part of that comes down to, is the current test appropriate? And that has to do with the extenuating circumstances. And the other item is kind of a larger high scale look. And that is, is this something the board would still be supportive of? Individuals from other professions serving as supervisors. The language currently in the regulation allows that. If certain conditions are met. However, that is something that the board has the ability to potentially change. And so the board, one of the advisory committees that were affected by that regulation, to have a little bit further conversation on that topic, and just whether it's a good policy for other professions to provide that supervision, or whether there's any issues there. So, additionally, there is an item that came up at the last board meeting that had to do with a change in federal law. There is I believe it's a federal statute called the Service Members Civil Relief Act. And there was a bill that passed recently that affected that, as well as portability of professional licenses for service members and their spouses. And our legal counsel has shared this with us, and we are looking at this to see how we can put something in place. It's a little confusing, and I think it's confusing for a lot of states that are wrestling with this and trying to implement this. But essentially, the federal law seems to point to that military members and military spouses will have an alternative to traditional licensure. If they are relocated to a new area, the idea with that would be that they could choose to seek to practice under their previous license, as long as that's still good in the jurisdiction where they had it. And if there was a similar scope of practice to what we have as a license in Kansas, then they could be able to practice here after providing us with certain documentation to demonstrate their license was current, they didn't have any disciplinary issues, etc. This is different than licensure, and that's part of why it's a little confusing, because the question would be, would they be listed in the licensure portal because they don't really have a permanent license here? Would there be sort of a registry, and how would be the best way for members of the public to know that a person was practicing here in Kansas? If something happened and we had a complaint against them, that's the authority for the BSRB, to find that individual or publicly censure them. We can't suspend their license because they don't have a license here. And so we're working through these different items. And so I want to put it on your radar. In case you hear anything about that, we're working through it. I know some other states are as well, like I said, but that'll be something that we'll try to address as soon as we get some clear guidance on it. I mentioned the board is working on expedited license review process and that language for the regulations that's coming together. The board is also in favor of looking at an RFP for impaired provider programs. Those are programs that can assist individuals who are licensed that are struggling with a mental health impairment or a substance use impairment. And there's different models for that. One would have a robust program that could be fairly expensive for individuals to submit themselves for treatment. Some states that do that, I think some of the associations pay for some of those services, but other systems are based on having it as a tool for disciplinary purposes. So there could be a disciplinary remedy that would look at, okay, we see there's a violation, but we also see there was an issue concerning substance use. So there was presence of some mental health impairments, and how can we use this as a tool in combination with other disciplinary remedies to really have a desired outcome that's appropriate. So that's what the board expressed favor of doing. And so I have been working with the Office of Procurements to see if there's any examples from this. There's really not a lot, but there are some recent agreements from some states that have put some programs in place. So I'm reaching out to my contacts from other states and trying to move forward with something to see what's available for services on that front. There's a discussion about the length of supervised practice time required to obtain a clinical license. You may recall that a lot of the clinical level licenses previously you had to get about 4,000 hours of postgraduate experience, and that recently that was decreased from 4,000 down to 3,000. When it was 4,000, the minimum length of time was 2 years that you had to complete that. And there's been a recent discussion as far as, well, if 2 years was appropriate for the 4,000 hours, if you decrease that down to 3 hours, can you decrease the length of time proportionally so that if 2 years was comparable to 4,000 hours, would 18 months be comparable to 3,000? And I think in general, there has been some support for this. However, there are also some complicating factors. For example, there was a recent change to law concerning Medicare reimbursements. And this is a topic that I am not extremely familiar with, but I've been trying to learn more about the law that passed and dealt with reimbursements. They're generally handled by other agencies such as the Department for Health and Environment and the Department for Aging and Disability Services. But one of the ways that they describe professional counselors and marriage and family therapists is individuals who have 2 years of postgraduate experience. And so I have reached out to contacts with KDHE to get some guidance. Let's see if they can provide that. It sounds like they're working through those issues too. I think one of the potential issues could be that Kansas is a little unique. Our licensure system was based on providing a lot of flexibilities. We have permanent levels of licensure that some states don't have. And so a lot of states just have a clinical level of licensure. And ones below that are called provisional or temporary, but we have permanent levels of licensure and different requirements for both. So I'm collecting information on that. I'm going to try to provide more information to the board on that. I'd be happy to share that with you as well, but we don't want to make a change and then inadvertently disqualify certain providers potentially from those types of reimbursements. So we're just trying to look at making good logical changes to the regulations that don't accidentally cause harm to practitioners down the line. And then there's another item that's going to be discussed. The board has an upcoming meeting. It's an offsite planning meeting on October 23rd, 2023. And one of the items the board identified for discussion at that meeting has to do with the current requirement of 1 hour of supervision for every 15 hours of direct client contact for individuals pursuing a clinical license. And so board has been doing a really good job recently of examining a lot of the current requirements and looking at them to see if those should stay in as they currently exist or whether those should be modified or updated. So really happy to see that. And I think that offsite planning meeting, which will be in Wichita, that is an open meeting if any individuals from public want to attend that meeting, but it won't be broadcast because of the limitations we have in doing a meeting at a new location. So And then just the last item that I will mention as part of my report is if I'm a little bit tired this morning, it's because for the last week I've been attending a couple of conferences on behalf of the agency. Last Monday, I left for Salt Lake City, Utah, and attended a conference for the Marriage and Family Therapy National Association with board chair Mary Jones, who's a marriage and family therapist, and received a lot of good information from that National Association conference. That was Tuesday and Wednesday of last week, and then that meeting ended at noon on Wednesday, and I immediately hopped on a flight to Cleveland and attended a National Association meeting for psychologists with board members Richard Noble and Linda Heisman Powell with the Association of State Provincial Psychology Boards. That was in Cleveland, and that meeting went through Sunday at noon. So I got back to Topeka about 11:30 last night, but lots of good information from both of those conferences. Happy to share that more with you, but haven't really had a chance to digest some of those big topics for you. But a lot of things in the works, things are moving forward. Really excited to see so many board members really plugged in and actively volunteering their time, getting involved with these associations and different things like that. So with that, I'll go ahead and end my report and stand for any questions.
Hey, David.
Yes.
Did you say that the BSRB is fully staffed at this point?
Yes, that is correct.
Oh, congratulations.
Thank you. Yeah, we a couple years ago, we had about 9 employees, and then we received approval to bring on one half-time employee so we had essentially 9.5 FTEs. That was 10 people. And then just recently, we got authority to hire 2 more. So now we're up to 12 people for 11.5 FTE positions, but we're fully staffed. There's been some cross training. So some individuals are kind of functionally split between the previous position and the new position, but yeah, really excited about the future now that we have everybody fully staffed.
Hey, David, I work here at the base. The thing about the portability of licenses for military personnel and those of us who work with the military is that, when we go to different places, it's just very difficult to start to fight with the whole process of trying to get a license to practice. And many military people usually stay 3 years, 4 years, they're moving. And those of us who work with them also move as well. Actually, I am on my way to Japan right now. And so I'm thinking if I was moving to another state, it'd be okay, now I need to get and start working to try to get a license. And it just gets very, very cumbersome. I don't know whether the compact will take care of that. Maybe, I don't know, but there should be a way. I don't think we can do it state by state. There should be something more national that, I don't know. And if it is, how we get into that is something we need to discuss. But I think it's a real challenge for those of us who work with the military. It's a huge challenge.
And I can tell you that one thing with this change in law, and I know that there's different people. I've heard that from different individuals, and I hear that from different associations too. And I know that there are people approaching the problem from different areas. And so one thing with the federal law, there was some language as part of that said if you have an existing compact, it's not meant to interfere with the way that compact works. And Laura is our compact commissioner for Kansas. So I don't know, Laura, do you want to weigh in on that question?
Yes, I mean, whenever we have compact commission meetings, military issues are definitely at the front and center. It will solve some of them. There will only be, when the compact starts, approximately 60% of states participating. So it's not going to solve all the problems, but it's definitely going to help. Any other questions for David Fye? Okay, thank you so much, David, for all the time that you give to our advisory committee and for the report. If anybody has any questions, don't hesitate to reach out as they come up. Okay, I will now move on to updates for about the multi-state compact. So we met, the Compact Commission met at the beginning of the NBCC conference, which was in Nashville in July. David was there. We attended a day-long meeting, and some of the things that came out of that meeting, October 25th, the Rules Committee will vote to adopt most of the rules for the Compact Commission. So at that time, it is assumed, unless there is some surprise topic that comes up, we will be able to vote to enact the compact and establish a date for it to be effective. It is assumed that that date will be early next year. We're hoping winter next year, so not that long. As soon as we have that, I'll let you know. I know that's a very important date and we're all waiting for it. There will be, we think, 30 states that will adopt the compact. And statistically, the APA, or the psychology compact, their data shows that within 2 years of their compact being put into place, that 15% of licensed psychologists in the compact states joined. So they're suggesting that we use that as a guideline to assume that maybe we will have about 15% of counselors join our compact, which is a great number. And, I guess we'll know, but they're just saying to anticipate that, a size about 15%. One of the things that David has been working on is background checks from KBI to coordinate that, so that when people become part of the compact, their background check is automatically downloaded into the database so that they can join the compact. The other thing that one of the topics that the Compact Commission has really focused on is adverse action rules. If you have an adverse action on your license, you cannot join the compact. And right now that adverse action has to be resolved for 2 years before you could then join the compact. We think that a 2-year time frame is going to stand, but it's still being debated a little bit. But we think, 2 years is what it's going to be. If anybody has any specific questions that you want answered about the compact, don't hesitate to email David and I. When I attend the next couple of meetings, I will get as many of those answered as I can, and I'll bring them back to our December meeting and give answers to everything we have. And hopefully at that meeting, again, we'll have a start date for the compact. So as soon as that develops, I'll let you know. Any questions at this time about all of that? Okay, well, let's move on then. Let's move on to old business. The first one, discussion of the clinical training plan. So David, do you want to go ahead and lead that one?
Sure. So I mentioned that we have previously spoken about a regulation concerning the requirements of clinical licensure, and for the professional counseling profession, that is KAR 102-3-7A. I'll go ahead and share my screen here. I'll pull a copy of that up. But essentially, there's a requirement that's the last item in that regulation. And it talks about updates to approved clinical training plans. And you should be able to see my screen there. So what this is KAR 102-3-7A, and then it's item 8 all the way at the end of that regulation. And it says all changes to the clinical supervision training plan shall be submitted by the supervisee to the board for its approval. The changes shall be submitted no more than 45 days after the date on which the changes took effect. If the supervisee fails to submit the change to the board in that 45-day period, no supervised hours of practice shall be accrued or credited for any practice beginning on the date the changes took effect from the date on which the changes to the plan are approved by the board. And so some of the discussion previously has really been on the impact that this 45-day rule has. And for individuals who did not submit that modification to their plan, it can have the effect of wiping out thousands of hours that someone approved because they didn't notify the board. And so it has made the question, well, if it would have been approved, but they didn't submit it, should that really be a factor that could be considered? Or should we be looking at whether it was a substantial change or whether it was sort of a minor change that, yes, technically it was a change, and this says all changes need to be recorded, but are there some changes that are so minor that they're really not even a change, and so we wouldn't have to disqualify all those things? Or should there be something that would say, if the change was not submitted, the board could review to see if the hours should be struck? And I think there's a lot of good ways to approach this to add more flexibility. However, that there are also some drawbacks to a lot of those conversations too. For example, in terms of individuals who are pursuing clinical licensure, who are really trying to get some firm guidance on what's expected of them, they would like probably to have a good understanding of what the word substantial means. And we could add a few items under that to kind of call attention to those. But ultimately, if there was something that they viewed as not substantial at the end, that would be an item maybe that they would want the board to take a look at. And adding flexibility for the board to review the cases when they come up. That could also pose some issues as well, because currently the board meets every other month for full board meetings, and then also meets under the Kansas Administrative Procedures Act, or CAPA, once a month for about an hour. But if we had a lot more items that would come before the board as part of an applicant's review, that could create a lot more need for the board to have additional meetings or take additional actions. There's a lot of things to factor in here. But also from our perspective as a licensing agency, we want to be able to provide clear direction for people. And so last board meeting, we kind of approached this in a new way of thinking about it. And that was whether we really need this 45-day requirement at all. And asking the board to consider, would it just be helpful to remove this regulation? Because basically, if the real issue is that the 45 days disqualifying a lot of the hours, then really what the board is wanting to, or at least what could be the goal, is to make sure that individuals are providing services under what has been approved, and the types of services that would fit under a clinical training plan. And so if you just remove this as an alternative, then if individuals did make a change, that could be reviewed at the end or when they submit that as a change. And then at that time, the board staff could take a look and see, is that something that still fits under the type of work that would be approved? But there wouldn't be sort of a rule in place to kind of strike all of those hours. And Leslie Allen is the assistant director and licensing manager for the office. And she and also our clinical licensing specialist work with a lot of people who apply for licensure and have to deal with these types of questions. So I wanted to see if Leslie wanted to weigh in, or if there's any items that I didn't talk about as part of that discussion you thought would be helpful for the advisory committee to look at.
No, I think you covered it. I mean, the thing that staff is struggling with, trying to, come up with a good plan for this, is if it says that they may submit or the board may deny the hours, we can't take files to CAPA unless they have an actual application. So we wouldn't be able to tell those people, give those people an answer until the end when they applied. So that would make it difficult. It would add more to the board meetings, and it would make it more difficult for Joan to give concrete answers when they have questions. So that's what we've been thinking about.
There has been a conversation as far as if we as an agency provided sort of reminder messages that if individuals did make changes, they should check with the board to see if the new type of work that they're doing is still in alignment with what would be approved for clinical hours. And so that might be a way to catch things periodically. But it would solve the issue of individuals who didn't submit changes in the 45 days and those having to be denied purely for violating this 45-day rule. And I believe I mentioned this at the past meeting, but in case, I know this is things that we work with on a day-to-day basis, but for those of you that volunteer time, this is a reminder. Essentially, I asked individuals from other states whether this 45-day rule is common practice, if this is a standard in different professions from state to state. And from what I have been able to find out, I don't believe that is. I have not found another state that has a similar rule in the regulations. That doesn't mean it's a bad rule or that it's not helpful. But if we did away with this, I don't believe we would be going away from any kind of a national standard.
And the onus really falls on the supervisor to know about those changes and to file those changes.
It's the supervisee in the regulation currently.
Oh, it says supervisee. I'm so
Uh-huh.
sorry. I do. So if that 45, if the 45-day rule is taken away, does that mean that if someone made a change and they never told us that they could lose everything, all their hours?
Well, the way it's worded, if they made that change and they didn't tell us, they would lose their hours at the end when they applied. So essentially, perhaps language that says you should submit all changes, all training plan changes to the board, but not give a time frame. So even if they apply later, at the end, they still have to submit the changes to show us that they would have met, that setting and that supervisor and all of that would meet requirements. That's how Joan would have to determine that.
I see. Okay.
Laura, Vanessa Perez has logged into the meeting, so she is present.
Great. Thank you.
And Vanessa, we are on old business item A, the discussion of KAR 102-3-788.
Thank you. Sorry I'm late, everyone. Good morning.
Good morning.
Morning. So any other discussion or ideas about this?
I was thinking that since David said that there are no other states that actually do this, I can see the reason why the 45 days was there is to scare people to do the right thing. I can see that. But it does make people in the office to have a difficult time trying to, somebody has done all their hours and say, by the way, all your hours are gone for a tech. It's almost look like a technicality or something. I don't know. So if we just put the language and without the days, I wonder what it will affect. Will it affect anything if we just put the language without the day, so that, but there should be some way to check it, because if you don't check it as a teacher, I know if you don't check things, people don't do it. That's another thing. So I don't know. It's a slippery slope here. I'm not sure. So there's a side of me that thinks take the 45 days off. But on the other hand, if you take it off, some people are going to come at the end and say, oh, by the way, I did this and did that and did that. You don't have any way of monitoring it. So I guess I am not sure. So David, you've been talking to other people in other states. What are you seeing that is kind of unanimous? Is there any,
I got to tell you, when it comes to things like continuing education, almost all the states require something like ethics. And usually there's a pretty consistent range. It might differ a little state to state. When it comes to supervision, there's a lot less things that are standardized. There are some states that basically say you don't have to have a plan pre-approved. You just go out there and start accruing your hours, and then you turn them at the end, and you hope for the best.
Without a license.
Yeah, it does not seem like the best policy to me. Other ones basically say you can get supervision from any individuals who would qualify to provide supervision. And so they're struggling with having 25 supervisors for one person. Some of them that only provide an hour of supervision over their entire time period. And so, I think there's a lot of states that are kind of struggling with wanting to accomplish a similar goal and taking very different approaches to it. So I do think the board is still supportive of having, the pre-approved clinical training plan, to make sure that that is still something that has been reviewed, that it would be in alignment with what we would allow for those hours. And I think you're right in terms of, this item was in here with some teeth, I think, to motivate people to report those changes to make sure that those hours would still be in alignment with the training plan. But it's had the effect of wiping out a lot of hours for not a lot of people, but when it has, it's had a pretty significant impact. And so that's why the board is really wanting to come to a better solution. But it's just challenging because there's really not a gold standard or even a widely adopted standard that I can point to and say we should be like this state.
So with that, I think that since we have a training plan, that should cover everything. Maybe we should add in that, and instead of saying just the supervisee, we should add that the supervisee in conjunction with the supervisor should forward something to the board just to have in the file and take the 45 days off. That's what I would suggest.
I don't see a downside to that. I think that sounds like a good idea. And then the onus would be more on the supervisor to make sure that any changes in the training plan are filed.
Absolutely. Because if it's just the supervisee, then you run into problems. But if the supervisee is working with the supervisor, so they both sign, then you can fine.
Yeah, supervisor should know. We don't, yeah.
Right. I think that the issue, although I really don't like having two people to have to do something that one person was doing. But just because it just creates a whole nother level of barrier. But I think the issue is if you don't put a timeline, then do you run into people turning it in the day they turn in their application, like at the very end? And if we're okay with that, like if people think that's an okay piece, that's the part that I think could be the issue. But ultimately, if they turn it at the very end, it may not be approved. So I think the 45-day gives people more likelihood that they will know if this is an approvable change or not.
There are situations, if they're working at a mental health facility, in which the supervisor may leave that position, and it may occur rather quickly. So the supervisee then gets another supervisor within maybe a week or two. And so that would be a significant change that would fall out of the 45 days. So, you know, there's those kinds of things that happen. And many people are working at a mental health facility in which they don't have control over certain types of things that may happen, like the leaving of a supervisor.
Since it looks like the main problem is the penalty, that seems to be the main problem. What if we just take the penalty and leave because it looks like the penalty is the main thing. The penalty of losing all your hours. I think that's for me, that's the crux of the matter. So why if we leave the 45 days and take that, just leave the first line and 3/4 and then take the rest of it off, so that if you make any changes, let the board know within 45 days and leave it at that. How does that sound?
Then what if they don't do it in 45 days?
That's what I'm saying. Take the penalty out so that, you know, again,
Right.
most of what we do as therapists is based on trust, by the way. Most of what we do as therapists. So I don't know how to, I can see when you put a penalty, then you have to enforce it.
Right.
So, you know, that's what I'm thinking about. Anyway, yeah, it's not an easy way to look at it. But anyway, those are my two suggestions, and I yield.
Any other ideas?
I think we already talked about, but maybe that's that we already thought all changes was too harsh of language, because we know not all changes are impactful to the training plan. Is that already so? An address change, things that have nothing to do with your ability to be trained. Is that already on the table to change that language?
We talked about substantial changes, which of course is a bit of a nebulous term.
Right. How do you then define?
Right.
But it's better than all, because all means anything at all. But
I can tell you that the ones that come in at the end and they didn't do a training plan amendment are not small reasons. It's because they moved, generally speaking, they either, most of the time they moved their work site and they didn't do it. They changed positions in their current agency and they didn't do it. And sometimes the supervisor, they changed supervisors and they haven't sent that in. So also, when we send out a training plan letter, when it's approved, it says who's approved as a supervisor. And if their name is not on that letter, that they cannot count the supervision toward their hours, because they put emergency supervisors and then they want to count like half their hours under them, and they weren't approved for that purpose. They were an emergency supervisor. That's one. We tell them they have how often they have to meet, 1 to 15, at least twice a month, with one being individual. So the letter does have, it's very lengthy, but it has a lot of information. And if they pay attention to that, even if they make changes, they should know how they should proceed.
I think it's important to have that accountability be there. We'd also talked about the board changing from will lose hours to may lose hours. And I know that means that the board would need, probably be called into some decisions, but that flexibility on the front end hopefully would allow for more people to be successful.
Yeah, that's the part we were wrestling with as a licensing staff too, because it would mean the board would have more ability to kind of weigh things under that process. But it also would create some issues from our staff, if people asked them for direction and said, well, this may not, I will lose these hours, and if something says may, I think the only thing that we would be able to say is, well, it's really up to the board and you can take a shot. But that level of ambiguity, I suppose, could be a little uncomfortable for us providing clear direction to them, because we would want to make sure that we have something that is somewhat as clear as possible and consistent. Even though there are going to be cases and a lot of things where it's going to come down to the facts, and you want some flexibility there. So it's kind of, we were trying to wrestle with that in terms of providing that flexibility, but also making sure we had clear and consistent standards that our licensing staff could help people with when they ask them.
So what do we want to do?
And the board is wrestling with this, and they wanted to allow the advisory committees to, provide some feedback. So if you do have feedback, we can take it and provide it back to the board for their discussion on it. And we have already talked about it before with some of those other possible changes. So I'm just kind of curious of your thoughts. And Bob Kircher just joined the meeting, so he's in attendance as well. And Bob, we are on old business item A, talking about the AR 102-3-7.
Morning, Bob.
Morning.
So taking, I mean, no one's ever said it specifically like that, but taking off the hours won't count, leaving the 45 days, and that they need to submit their changes. But then if they come in after 45 days, we can still review them and approve them, because they won't, it won't be required that they go to the board. So we could review it and then give them an answer, yes or no. And if it doesn't count and they waited more than 45 days, then that's kind of on them.
Mhm.
Well, and I think, if they had an application and there was something that would come down to, depending on whether they can be licensed or not, that could be something that they could have with the Kaplan board to determine that flexibility as well. So maybe it would be helpful just to remove that last sentence that talks about all the hours shall be removed. And then that would still include the requirement. And then in terms of how that requirement will be enforced, there will be more flexibility with that.
So any more ideas to add to what David just said?
I think I like what David just recommended is basically we're keeping it in, but we're taking out that those hours will be removed. I think it gives more flexibility to the supervisor as well as the BSRB to review those hours and ensure that they are acceptable. It's just my opinion.
And it sounds like it goes from less punitive to more of a natural consequence. If it's not acceptable, you waited a long time to find out these are not acceptable.
Exactly.
And David, are you saying change it from will be removed, hours will be removed to may be removed?
I think I would just recommend deleting or removing that last sentence. So it would just say all changes to the clinical supervision training plan shall be submitted by the supervisor to the board for its approval. The changes shall be submitted no more than 45 days after the change on which the change took effect, and then you get rid of any of the language after that point. So if they didn't submit the change and they didn't submit it within the day, that would be something that would be against the rule. But there's not the strict language that says the penalty for doing that is you're going to lose all of your hours. So it would say, you're still required to submit those changes, but then if someone does have an application and they didn't do that, that would allow the board to be able to weigh that and determine what to do in that situation. But we would be able to have clear instruction for them that this is the requirement, and so you have to follow the requirements.
Okay.
And the board could give staff authorization to approve changes even if it's after the 45 days, if it meets requirements.
Yeah, that's a nice way to leave that 45-day limit in there. It's just a nice stopgap so that we can catch the people that need to be reminded. Yeah. So are we agreeing that this is what we want to do?
That's what I'd support.
See a lot of nodding heads.
Yeah, I support that too. Definitely.
So do we need a motion? What do we need?
You could do a motion, or if there's consensus, we can move forward with that. So you could ask if there's any objections, or you could ask for a motion from that meeting.
Okay, are there any objections? Let's go that route. I don't see anything. Okay, so we are agreeing to those changes and we don't need a motion. We just have consensus.
Okay.
Is that good enough?
That's good enough, and we can have that forwarded back to the board so they can review that from your advisor.
Great, thank you. Thank you everyone for your input and for your ideas. Okay, are we ready to move on to the next item of old business? Looks like we are. Okay, continue discussion of unprofessional conduct regulations from other professions.
Yes, and this is a topic that we've talked about for some time now, actually. But it's been a really good conversation, really good discussion. Part of this started last year. The advisory committees each have a different set of unprofessional conduct regulations. And it basically says that the following would constitute unprofessional conduct. And we asked each of the advisory committees to review their unprofessional conduct regulations to look to see whether there was information that was missing and needed to be added, whether there was information that was outdated and should be removed, or whether there was vague or ambiguous terminology that needed to be clarified for better understanding. So you all went through your unprofessional conduct regulations. You came up with proposed recommendations. You and the other advisory committees, those were all forwarded back to the board. And then the board basically has determined that the sets of recommendations from all the advisory committees are going to be sent back to the advisory committees. So that way you can see what, let's say, the addiction counselors advisory committee recommended and what the social work advisory committee recommended. because those conversations were probably a little different than yours. And then you could look to see, okay, well, with some of the items that they recommended, would those make sense to be brought over to your set of unprofessional conduct regulations and vice versa? And ultimately, for these to be adopted and changed, the board would have to vote on the specific changes, but they work with the advisory committees in each of these areas is going to be very helpful for them. And so you had a packet of material. I believe it is 42 pages long, but essentially it is the unprofessional conduct regulations for each of the professions with all of the markup changes that have been previously proposed. And so wanted to allow you to have some additional discussion today to see if you saw something in another profession's regulations, or whether there was something that perhaps you thought would still be helpful to add to yours new before it actually goes to the board for the board to make real concrete decisions on changes with regulations.
Okay, so I know you've all toiled over these 42 pages. And does anybody have any feedback?
I just had a question at the very end of each one of these is a section that, was that something that the board recommended, or I can't remember discussing that wording, or
And
Are you
Bob,
talking about all the red lines?
yes.
so the red lines here are basically, there's a lot of discussion about proposed changes. And so we had tried to sort of mark up the existing regulations with proposed changes. And so for some, they had totally new language they wanted to have added, so that usually followed the end. But for other ones, there were certain phrases they wanted to have added or certain words struck. And so we have marked it up with all of the previous advisory committee recommendations, and we can mark it up further if there's any additional recommendations after this.
Well, what I was really wanting to know is, it looks like there's a standard set of wording at the end of each, talking about adequate identifying data, and it's like on the next to the last page of each of them, it's inserted regarding patients, or regarding, I looked at it quickly, I'm not sure I'm telling it correctly.
One thing there, so there, for some of the professions, there was separate regulation when it came to unprofessional conduct concerning record keeping. And so some of that was to combine those two regulations together. And so for some of them, they have existing wording of that that's been, we've attempted to modify it to bring it over. And then for another one that was pretty commonly adopted, there was a previous advisory committee for professional counseling, I believe, that looked at some possible social media language. And a lot of the professions like that or wanted to do a version of that. So some of those items have also kind of been brought over in similar form. I think there might have been another item that dealt with practitioner records. If a practitioner was incapacitated or had passed away unexpectedly, I think there was an effort to sort of add some of that language to some of the regulations as well.
Okay, thank you.
And just for reference, the professional counseling recommendations, I believe they start on page 30. I think they're 30 to 36. And the one item on yours, and one of the challenging things, so as a composite board, there are 7 different professions. And while we do strive for uniformity between the professions, we also recognize that a lot of the professions have a national association that sometimes provides direction on things like unprofessional conduct. And so I know there's also an interest by some individuals to make sure their unprofessional conduct is in alignment with other national association would recommend for certain things. And so that's kind of the push-pull, figuring out the right spot between what the other professions under the BSRB are in consistent uniformity with, and then what the associations for your specific professions might be on paper, right? And so that's kind of a fair discussion, and I can see it both ways, and so that might explain some of the differences when you're looking at different items that might have some alternate language.
Yeah, I believe that when we took a look at this the first time, we used the ACA Code of Ethics as the standard that we were comparing it against. So,
And I think that's the question I had is much of it looks like it's using more sensitive language, which I think is really good. But then there's areas in which they've added in entirely new sections, and I was just wondering where that was pulled from. And it sounds like maybe it was pulled from the ACA code. Is that correct?
depends. Some of it was definitely. Some of it was, as I recall, was some wordsmithing. We were trying to get it as close as possible, and yet have it defined as we thought it needed to be defined in statute or in the regulations here. So
There's one more topic I'm not sure I mentioned earlier, and that is distance counseling. There was a discussion by a few different advisory committees as far as telehealth practice specifically, and some advisory committees thought that was sort of between the lines in terms of confidentiality and professional practice and things like that. Other ones wanted to have sort of a specific section dealing with telehealth and telepractice and what are the expectations there.
So as our regulations are presented today, is this at the point where the board wants us to go back and either adopt this copy, or do we want to, are they looking for us to amend this further?
Well, if you believe this looks good and you don't have any further recommendations, that's sufficient. I think just since we had recommendations already proposed by the different advisory committees, the board just wanted to give their advisory committees a chance to look at what other ones have done. And so that way, if you want to make further changes, you could. You definitely don't have to at this point. If you don't, basically what the board will do, we'll look at this and then any further recommendations maybe from our staff, and then decide as far as adopting those changes to regulations, and then they would have to go through that regulatory process.
So our choices are adopt them today or hold on to them longer, make maybe some changes or decisions for December and then adopt them.
Yeah, and I know there's one other advisory committee who would like one more opportunity past this meeting. And so we had talked about the goal was by the end of this year to kind of present them to the board, for the board to really make some decisions on them. But I think if we still need a December meeting for that, and these set of regulations for your profession have not been updated since 2008. So it's been 15 years. And so I think any changes would be positive, but definitely as long as the regulation change process takes, it would be good to make sure that when we do submit the changes, we do them in a good way. So we could use the December meeting too.
So does anybody have any strong opinions about adopting them now or waiting until December?
Well, I do have one question regarding the record keeping. I was just wondering the difference on page 17. It says 5 years after the date of termination of the contact. And then on page 20, I think 24, it says 6 years after the date of termination. I was wondering what those two are applying to and the reason they'd be different.
at the time, I think you're talking about hours on the second one.
I think they're both applying, unless I'm reading it wrong, applying to the time that you maintain records.
The first one that you mentioned on page 17 is for the licensed psychology profession. And then the next one would be for marriage and family therapy profession. But I'd have to take a closer look to kind of see why those year ranges are different.
So just a different time period for different professions.
and that might be, yeah, I was initially wondering, the behavior analyst, work more frequently with children. And I know that there are some differences when you have minor clients, versus adult clients, but this appears to be the psychology versus the marriage plan therapy. So I'm not sure.
Yeah, I think both these apply to the adult side. And it looks like with the children, it's 2 years after they become, after the age of, what, 18, I would assume.
And I believe ours says that will be the time frame for record retention for adults and minors should be consistent with state law.
Right.
And I think when we did that originally, we were unsure what state law said it needed to be. And that was one of the items that we were still wanting to know about, if there was a related to state law, how long records must be kept. At least we were not sure of what that was.
We don't know that now.
I have a note to talk with our legal counsel and see if there's consistency between
Okay.
different agents or standards.
Yeah, thanks for catching that. So that's one, okay.
It is confusing because I know on our medical side, they have to retain, I think, for 10 years. But I think it's a little different on the mental health side, and I cannot, for some reason, 5 years sticks in my mind, but I cannot remember. Except for kids, of course, that's a little different.
So ours says 5 years and it doesn't specify minors.
Yeah, I know the minors is always, I think, 2 years once they reach the age of 18. 2 years after the age of 18.
Okay.
Other than that, that was the only question I had in there. The rest of it looked good. And I'm not sure that that's wrong or anything. I just wasn't sure. So I was just asking.
No, that's a good question. And I think unless there is something specifically in the statutes or regulations that will really call out professions, it would make sense, I think, and that be consistent between professions.
So do we want to get that question answered and then bring any other questions back to December, to our December meeting?
That sounds good.
Okay. Do I need a motion for that or consensus, David?
I think that's fine. I think we'll just to continue this on for a whole business for the next meeting. I think that's fine.
Okay. Okay. So continue to look, and if you find anything else, we'll discuss it in December, and we'll get back to you on topic number 43 about matching state law for retention of records. Anything else about this one? Okay, let's keep moving. Supervision by licensees from other professions.
And so this was something that you had discussed at a previous meeting. And I'll go ahead and share a regulation on this topic. It's the AR 102-3-78. It's postgraduate supervised professional experience requirements to be licensed as clinical professional counselor. I'll share my screen on that regulation. So under that AR 102-3-7A, it talks about qualifications for supervisors. And then under item C, it says the clinical supervisor of a person attaining 3,000 hours of postgraduate supervised experience required for licensure as a clinical professional counselor at the time of providing supervision shall be a board approved supervisor and shall meet one of the following provisions. And there's 3 provisions there. And the first, they could either be a clinical supervisor who's a professional or clinical professional counselor who is licensed in Kansas or is registered or licensed in another jurisdiction and who practice as a clinical professional counselor for 2 years beyond the supervisor's licensing date. So you have to be a board approved supervisor and that, or board approved supervisor and item 2. If a licensed clinical professional counselor is not available, the clinical supervisor may be a person who is qualified for educational coursework and degree for licensure as a clinical professional counselor at Kansas and who has at least 5 years of postgraduate professional experience in clinical professional training counseling. And then the next item will be item C3, which is really at the heart of this. Under extenuating circumstances approved by the board, the clinical supervisor may be a person who is licensed at the graduate level to practice in one of the behavioral sciences and whose authorized scope of practice permits the independent practice of counseling, therapy, or psychotherapy. The qualified individual shall not have had less than 2 years of clinical practice beyond the qualifying licensure date when the individual provided the clinical supervision. And so I believe there was some conversation in the past that really involved the test for whether someone could provide supervision under item C3. Because it does say under extenuating circumstances as approved by the board, and then it gives that possibility. Extenuating circumstances is a term with a very specific definition. And the way that it's defined is that it would call for an extreme situation beyond the person's control that would either result in them not being able to comply with the requirement or would make it inadvisable for them to comply with the requirement. And so what we have had at the board staff level is we've had some individuals submit a request to have someone from another profession serve as a supervisor. And the reasoning they have said is they said that we have someone on staff and we would like that person to provide the supervision rather than pay for supervision from outside of the agency, or the cost for someone outside of our staff is a significant factor. And so either convenience or cost, they were using those to see if those would be suitable as reasons for having someone serve as a supervisor from another profession. And so in weighing those determinations, under this existing language, it does say under extenuating circumstances. And so the question is, would those scenarios, those types of scenarios, really be extreme situations that would be outside of the person's control? And in terms of applying that extenuating circumstances thing in the past, we've had situations in the past that have involved the pandemic, some that have involved significant health emergency type thing. And so that's kind of what we apply extenuating circumstances to. It's not about availability. And some people have also said, well, there's not someone close, but with supervision being opened up and you can get all these supervision hours now face-to-face by screen, having someone in the same physical proximity really is not involved in the language of this regulation. It doesn't really talk about how close they are. It has a different test. And so the question the board is wrestling with, and I think that you all weighed in on before, was whether those types of scenarios would really fit the test of extenuating circumstances. One new item the board was discussing at the last board meeting was sort of one bigger picture perspective of, do you even think it's appropriate to provide an option for someone from another profession to provide supervision over individuals from your profession? There's language here that allows for that. And there are some professions that don't allow for that, and others that do. For the addiction counseling profession, there is some language that allows individuals that have other licenses to provide clinical supervision to the addiction counseling profession. And so I just kind of wanted to share that with you and kind of bring to you the new item the board wanted the advisory committees to discuss. And that is, there is the test conversation about extenuating circumstances that as a second item to discuss. You know, given the concerns that were brought by the Marriage and Family Therapy Advisory and the concerns that were previously expressed by your advisory committee, do you want to continue to have this language and regulation that allows people from other professions to provide supervision, people from yours? So just want to open up for that type of discussion. And Leslie, if there were any comments from the board meeting or Laura, feel free to weigh in as well.
No, yeah, just, yeah, no, I think you covered it.
How do we feel about this?
I feel it's important to, I mean, it's my opinion, I guess, but I feel it's essential that whomever is supervising is from that profession, especially for the LCPC. For any clinical level, I mean, I think it's essential. And given, extenuating circumstances, well, yeah, the pandemic would have been one of those. But with telehealth approaches, I'm not sure that that's a legitimate issue at this point. Availability is not an issue, even though that would be a common, I'm sure, request based on that. I don't think that that's an issue, legitimate issue.
I would say, although I can understand Bob's perspective, I do think there is some overlap in the helping field that is important to learn through. And I do think that when I was in school, even took courses in marriage and family therapy departments, and have my own students take them in different areas too. So I think the idea of completely siloing is, I don't see that as the long-term direction for us. And I do think the extenuating circumstances piece, I mean, this is like a last resort. So I wouldn't want to just have it like as an absolute. I think the absolute part seems, I don't see the benefit of it, I guess.
What professions don't allow that? Or the other
Don't allow the overlap. I don't know if any of them currently allow a lot of overlap. Marriage and family used to allow overlap for supervision from LCPCs, but I don't believe social work has ever allowed any overlap of supervision, which I can understand. There are some different training aspects, but when it comes to psychotherapy and doing psychotherapy work, then the training is similar, but there's other work that's done besides psychotherapy work, and especially in the social work field.
Social work does not allow alternate supervisors, and psychology does not, and master's level psychology does not.
Yeah,
Addiction counseling allows any profession that's independent, but they have a very limited scope. So
it could be a social worker then, the way that it's written.
yes.
I don't have any problem. We have actually during internships, you can have somebody else from a social worker, psychologist to supervise a counselor if they want some kind of experience that will be provided by the psychologist or the social worker. But at the clinical level, I agree with Bob. It should be exclusive, because now you're training counselors. These are independent counselors, should be trained but should be supervised at this level by another counselor. I don't think we should. When you're still doing your internship in school, you have different experiences. That's fine. And again, like you said, with the internet, right now you can have a supervisor in another city and you supervise you. But I think it should be a clinical counselor supervising and a counselor to become clinical. I don't think we should change that. I really don't think we should.
I think we ought to remove the extenuating part of this, that there may be circumstances, but I think extenuating is pretty harsh. There are circumstances in which it may be difficult, either online or in person, for an individual seeking clinical status to find someone who is willing to supervise. So I feel like the extenuating part ought to be removed.
You know, I think this is also an argument for moving toward board certified supervisors. Because one of the issues that I run into isn't so much with the field, it's more with the supervisor not being well trained in understanding the ethics of the field in which they're supervising. And that's a big piece of it. You have to be able to teach, you have to be able to answer questions, you have to be able to know what the ethical codes are for whoever you're supervising. And so that's just a concern I've had and seen in the past. But
We do have board approved supervisors now.
Yeah.
LCPCs have to be board approved, but we don't require that and we even allow alternate professions to become board approved supervisors. In the past, before all video could be used for supervision, there were people in places, there were no LCPs available, LCPCs.
Well, I went through that, and I'll tell you, I was one of them that went through it because I had to, and I went through it kind of kicking and screaming because I didn't want to. But I will tell you that after it was done, it was extremely beneficial. I cannot put into words how beneficial that training was. They help you develop plans, they help you develop all kinds of documentation. They teach you the laws, the regulations. I mean, it was a really good training.
Which one did you take?
Mine was the year it came out, and it was, I can't tell you what the title of it was, but I went to Wichita and spent 2 days.
Oh, okay.
Yeah.
Good feedback.
I guess another piece I'm wondering is this 3, the one that we're really looking at. I mean, obviously you start at the top and you try, and supervisee tries to get the first supervisor, the second supervisor, right? Only till they get to 3 when they've struck out with all these other types of supervisors. Is 3 sometimes used for secondary supervisors or group supervision? Like, that's what I'm visioning. People would say, like, oh, there's a group supervision offered, but it's a marriage and family clinical licensed therapist. Is that what it's used for? Or is it often used as their only source of supervision?
The only source, it could be either, but typically it's their only source. And just while you brought that up, number 2 needs to be removed. I think that was put in place when we first went to clinical licensing, and we don't allow people, if they don't have a clinical license, they can't be a supervisor. So we need to remove 2. If anyone disagrees with that, please let me know. But the problem is, at staff, we either need a list of what extenuating circumstances are, or the language needs to be changed to allow more flexibility and a list be provided, but the way it's done now, the people that have sent in training plans who want alternate supervisors, they are not extenuating circumstances. It's almost always part of their agency, and the agency says it costs too much money to pay outside supervision, things like that, which are not, typically considered extenuating circumstances.
Yeah, I kind of think they are extenuating circumstances for a brand new licensed therapist.
What are extenuating circumstances? I'm sorry.
That's the available resource that they have.
Oh,
I think the concept of extenuating circumstances has generally been seen. I think the official language in that definition talks about it being an extreme situation. And so it's got to be something that is really significant. Now, it being outside of their control, that part of the definition, that makes sense. But usually, in extenuating circumstances is something pretty extreme and something unusual. And on some of these requests, it sounds like there's definitely some reason behind why they would want it to be that way. And if there was a different test, seems like the different test might fit that a little bit more. But extenuating circumstances has generally been seen as something that was fairly extreme.
I guess I'm not understanding what could be extreme. I'm not understanding the term extreme. Like,
When we put this in, it wasn't all clinical supervision was allowed online.
Right. There are less extenuating circumstances now because of distance. Now we can connect to people through telehealth.
right, but the part that seems interesting is that we're saying that cost is because it's convenience, but travel is convenience also. I mean, nobody wants to travel 6 hours, but they're capable of traveling 6 hours. It just seems like that doesn't seem fair. I feel like if somebody has to pay out of pocket when supervision could be offered through their agency, that also doesn't seem fair.
There's also the agency may want that person to have as a supervisor, someone who is working in that agency, rather than that person going outside of the agency. So maybe the person who is the supervisor of therapists there is a clinical social worker or a clinical psychologist or a clinical marriage and family therapist. So to me, it seems a bit extreme to require that they have to go outside of their work environment in order to get supervision when it is being provided there. And the mental health facility may not really want an outside supervisor, somebody who's providing services within that facility.
Can I say a few things here? You know, it was those of us who work in the military now who are counselors. It's thanks to the work that the ACA has done a lot for us to be able to get a job here. There was a time when to be able to work here, you had to get a social worker to sign off, or your psychologist to sign off for you to do anything with whether the VA or any part of the military apparatus. But the ACA worked really hard. I remember in counselor education, there was a time when a lot of psychologists and social workers were teaching in our counselor ed programs, and the ACA put their foot down and said, no, if you're going to teach in a counselor education program, we need counselors, training counselors, not psychologists and social workers. And it was a big shift. I still remember that. In my school, where I taught at the time in Kentucky, it was a big shift. It looked like discrimination, but counseling is the youngest field in the psychology and social work and all of that. So what we're trying to do is an identity problem here. I think it's an identity thing. And so if you don't have your own identity, even if somebody's working in another agency and they have a counselor there, they want to be a PLPC, you need to be supervised by a counselor because it's an identity problem. It's not just clinical, it's an identity. The identity is a clinical counselor. Social workers, when you look at the training that social workers get and the training that counselors get, there are similarities, but they're different. There are a lot of similarities, but they're different. The same thing with psychologists as well. So at a clinical level, you are reaching the pinnacle of your career as a counselor, not just a clinician. Anybody can be a clinician. You're reaching as a counselor. So if you don't maintain that, you're losing the identity of what it means to be a counselor. And I work here, I have friends, I work here, we have psychologists, we have counselors. There are things that counselors do that psychologists don't necessarily do, that social workers don't necessarily do. That's what the clinical supervision is about. It's about creating the identity of a counselor. And if you miss that, then you're going to be a clinician, but you're not a counselor in the sense of having an identity. So that's what I think. Again, I'm going to leave it at that. So I
In
think we
K-CREP programs, the identity of the counselor is very important aspect. So students who are in K-CREP programs, that is being emphasized within those programs. So, ideally, they should have that identity pretty well ingrained by the time that they graduate from that K-CREP program, or the program that has K-CREP standards but isn't necessarily K-CREP accredited yet.
true. I agree. Hey, I'm gonna leave it at that. That's my thought.
That's my thought too. From
You know, one of the issues is that you're also talking about people who are coming from programs that are not K-CREP accredited, but do not have those K-CREP standards that they are trying to abide by. That's the other angle to that. And what we're trying to do is we're trying to protect, the whole purpose of these regulations and statutes are to protect the public. That's our main purpose, is to protect the public from people who are not well trained and not providing the services that need to be provided.
Yeah, I want to piggyback on what Bob said there is in trying to remain impartial here, but just looking at it from an agency perspective, one of the things we run into is not always knowing these supervisors. We don't know the quality of them. So sometimes we run into a situation where we have somebody who has a supervisor they've chosen, but as the agency has no familiarity with them, we really don't know if they're going to be providing a good training or not. And that is a concern that we have as an agency. So just something to think about on that too.
So the other, is it marriage and family therapy that also has something written in the same way?
Yes. And from their meetings, they're going to be discussing the same thing as you in their next meeting. And Mary was going to take back, did they want to take away the ability to use other supervisors? Because everyone on the committee felt very strongly that it should be an LCMFT who provided their supervision. They come at it from a different perspective, and they felt that was important.
several years ago, when I was in practice in Texas, I went through the supervisory requirements for approved supervisor for marriage and family therapy. And they are pretty rigorous, and I did gain a lot from it. And I can see where for LCMFT, the concern for having a person who may be systemically oriented is an important aspect of providing marriage and family therapy. But that's not necessarily the case as a LCPC.
How many approved supervisors do we have in professional counseling? Do we, those figures are available?
Let me, if you hold on, I'm going to call Ashley.
Okay.
Well, she's calling Ashley, and we're going to be talking either today, maybe not today because we're starting to run out of time, but definitely in December about what are some of the items that we want to advance on next year's agenda. I definitely think that supervisor training, increasing the number of supervisors for counselors in our state is something that's very important. And so please.
I think it'd be nice to expand that across all of the disciplines.
I'm sure.
I'm a little concerned about tying the hands of the BSRB by saying you have to be supervised, because it's hard for me to predict what circumstances would come up. But I like the idea of giving them the authority to approve that if needed, but putting an emphasis on the importance of having a supervisor in your field. Because it sounds like we're trying to transition to making this very black and white. It's either in your field or nothing.
Well, and I think that's why there were the kind of two questions. There is the issue of do you want to still leave open the option of people from other professions providing supervision? And then the second question is that if you do want to continue to allow that, what would be the appropriate test? The initial process here would be number one, have somebody who's a clinical professional counselor. But if you do want to allow some flexibility from people from other professions, what process do you want to use to go ahead and have that be a consideration? Because the extenuating circumstances, at least in the past, has usually been a pretty high threshold to meet. Leslie talked about it as it related to people doing supervision by televideo instead of in person. Or now I believe we have some language that says, even though it's all available over video, you can do some over the phone under extenuating circumstances, like if technology just failed. And so, but it would have to be an extreme situation, the board would have to approve it. Here, it's kind of hard weighing what an extreme situation is, but an extreme situation could be something, or if there needs to be a different standard, I guess that's kind of the second thing for the standard feature.
Has the BSRB reached the point where we have enough licensed clinical providers that could meet the needs of supervisees? I mean, do we have enough supervisors at this point, people who are willing to provide that service?
There are currently 253 board-approved LCPCs.
I never get feedback from staff that they cannot find somebody.
Okay.
I wonder if that is the same for rural Kansas. I think it's very different experience out there. I think in the bigger cities, you are more saturated and have more options. Whereas out there, I think there are some options. I think they're more limited. And I think if you're looking at it from a standpoint of they have to meet with their supervisee in person, then that does add on, travel time to the person to get to that supervisor. And that, it could be anywhere from, 30 minutes to an hour, depending on where you're living out there.
We don't require that they meet in
Okay.
person anymore.
Okay, thank you.
Mhm.
Then that makes sense. Then it probably wouldn't be as big of an issue.
Yeah,
Sorry.
that was the problem. That was, yeah.
That was my experience when I was out there. That's why I was
Yeah.
curious, and I apologize, I missed that part that they can now see them.
Yeah. Back in the old days, we didn't have that option, and I did drive an hour.
Yeah.
So
Leslie, how do we
Yeah.
publicize the approved supervisors? Do we? How do we do that?
Well, they can do on our mailing list order form, they can request a list of LCPC board approved supervisors. In addition to that, Marriage and Family Therapy asked that we put in their letter when they get a license that they can contact the board for that list of LCPC board or, LCMFT board approved supervisors. So I would do the same on the LPC letters, letting them know that's how they could get it.
I was just wondering if there was the data system that's being used currently allows you to pull off names by professional license, etc.
Mhm.
You can provide a whole list. Is there some reason that we can't do that? That would make it available.
You mean like where we do the verifications?
Yes.
I don't know. We would have to ask the people who manage our system, but we could definitely ask them if that could be an option. Also, we have talked about putting the list on the website, and we've gone back and forth. The problem is that if we put it on the website, anyone can look at it, and it's your address, your email, your phone number. So we didn't know how how the supervisors would feel about just putting that up there for everyone to see.
Leslie, did you say there's 250 board approved supervisors?
Yes,
Okay. LCPC supervisors,
yes,
and which is different from LCPCs.
correct.
And there are about 1,000 LCPCs, is that correct, or something like that?
That sounds about right.
Good ratio.
Mhm.
Actually, it's
We spend so much time as a board and as an advisory committee differentiating the different disciplines. And my opinion is that at that very important juncture, when you are getting supervision, it seems to me very important to have an LCPC supervising you so that you stay with the congruency of understanding the statutes and regs as they apply to counselors. It feels like a very important time for that congruency to be in place.
Yeah,
I
create
shared-
some trust.
I just shared a report that we present to the board at every full board meeting. It's a historical history of licenses, permanent licenses. And for the LCPCs, yeah, as of beginning of September, there were about 1,200 LCPCs and then almost 1,100 LPCs. And I know we're running short on time. This has been a great discussion. Really appreciate the different viewpoints and the different positions and stuff. And more, feel free to let me know if you have thoughts, but sounds like maybe this is something to kind of continue talking about. But I'm not sure I'm not sure that I'm hearing a consensus one direction or another on this right now. So.
No, it definitely sounds like we need to think about it and bring it back to in December and decide.
Yeah. I agree.
And I know there's two more items on the agenda. And I think just because of how short we are in time, or if you don't mind having the conversation about the examination, if we can continue that to the next meeting.
Certainly.
There's one new topic I just kind of wanted to queue up and have the members start thinking about so they could maybe do a little bit of research on or think about for the next meeting. So,
Okay.
so how about if we go to new business item A, and that's discussion on possible changes to KAR 102-3-3A B1. And just to kind of frame this conversation, just as a starting point, we can talk about more next time. I will share my screen here. So this involves the requirements for licensure for a couple other professions. We have some language, I would say, it's my perception, but the history of our licensure in Kansas was really focused on flexibility and thinking somewhat outside the box and creating some permanent levels of licensure that a lot of other states don't have, and trying to help people become licensed in a lot of different flexible ways. Now, flexibility is not always fast. It can mean you have to look at things multiple different ways. But we have regulations that essentially say if you have come from a program that is nationally accredited, then we can move you through the licensure process very quickly. If you come from a program that is not accredited, we will be able to consider you under some other methods that we generally refer to as educational equivalency. And so I'm sharing here a copy of some language from the Marriage and Family Therapy Education Regulation, KAR 102-5-3. Essentially what it says here is to qualify for licensure with a master's or doctoral degree from the Marriage and Family Therapy program, both of the following requirements shall be met. And then the item number 2 I wanted you to focus on for the purpose of this conversation is it says the Marriage and Family Therapy program through which the applicant completed a master's or doctoral degree shall be accredited by the Commission on Accreditation for Marriage and Family Therapy Education. So it identifies the specific accreditation body. For social work, under the KAR 102-2-6 program approval, it says under item B, be recognized and approved by the board, undergraduate or graduates for social work program shall be accredited by the Council in Social Work Education, CSWE, or shall be in substantial compliance with all the following standards. So there is other requirements and regulation we could consider for educational equivalency, but this also points to a specific national accredited body. So the reason I brought both of those up is because I wanted to show a language that currently exists for the professional counseling regulations. And so well, I had identified that a little earlier. Here we go. It is under KAR 102-3-3A. And I'll get my screen here. So for professional counseling, what it says is to qualify for licensure as a professional counselor or a clinical professional counselor, the applicant's education shall meet the applicable requirements specified in this regulation. And under item B, it says the time of application, an applicant shall have met the following requirements. And then receive either a master's or doctoral degree in counseling or related field from a program that meets one of the following requirements. And what it says here in item A is not below the accreditation standards of the Council for the Accreditation of Counseling and Related Educational Programs. And the reason why I have highlighted the term not below is because whereas the other professions essentially say you either come from a program that is CSWE accredited or you meet the alternative requirements and regulations for educational equivalency. And the same thing with marriage and family therapy. This language is slightly different and it doesn't say KPREP accredited or the other. It says is not below the accreditation standards of the Council for Accreditation, essentially KPREP. And so what it does is instead of creating two pathways to licensure, it somewhat creates three. And from the licensing body's perspective, it makes it very challenging for us for a handful of cases, because essentially we will look at an applicant's material to see that they come from a KPREP accredited program. And if they didn't, we will look to see is their program claiming that they are not below the accreditation standards. If they say, yes, we are below the standards, but we meet your regulation, we evaluate them that way. But for the ones that say we're not accredited, but we're also not below the standards, that means that we have to bring in an outside expert to review their program and coursework. And we have this expert essentially do or attempt to do the same job that a national accrediting body does by reviewing all of those things. And that creates a pretty big burden on our body. And we have tried to accommodate that. And we have hired experts and provided that service on behalf of applicants and paid for that as an agency. But we are feeling tremendous pressure from the legislature and from outside employers to move as quickly as possible on any applicants. And these ones are presenting quite a significant challenge. And asking our experts to review someone's program to see if they are not below the accreditation standards is really, really challenging. And so the item I wanted to bring to you to think about for the next meeting is whether it would be appropriate to change this language from saying is not below the accreditation standards of KPREP to just say is either KPREP is accredited or meets the requirements and regulations. That would be more consistent with what social work has, marriage and family therapy has. It would provide two paths to licensure instead of three. And so while I hate to limit individuals' ability to get licensed, I don't think this will affect a whole lot of people, but given all the pressure we're feeling right now to move people through as quickly as possible, I think this is probably a reasonable change. And I wanted to bring it to you to discuss at the next meeting to see what your thoughts were on. And I realize this is kind of a fine distinction here, but I think it is something that would be more helpful for us. And I think it would be cleaner in terms of our processes. And so I'm going to bring it to you to discuss the next meeting.
How would you word that again?
Instead of saying it's not below the accreditation standards of KPREP, I would say it's either accredited by KPREP or meets the requirements and the regulations. So just removing the not below language, but basically say They either have to be K-PREP accredited program or meet the alternative requirements. And that would be more in line with the other practice.
I'm
So,
glad we're going to discuss this. I can tell you that I've been, involved in some of these discussions and some of these cases, and I can see why taking out that language and flipping it would make a huge difference in those unique cases that end up dragging on for months.
and like I said, I hate the idea that we would make it remove a possible path to licensure, but it's not going to affect a great deal of people. And given the pressures we're feeling to move people through, I think there's been sort of a focus and a shift between having as great of a flexibility as we have to get licensed, and more of a streamlined approach to make sure we're licensing quickly. And I think it's necessary, unfortunately, at this point, to move that direction, given the concerns.
So can I add something else about this? Just real quickly, especially to the educators. We also, even if a person attended a K-CREP program with 60 semester credit hours, they have to have our specific coursework, which is not the same as K-CREP. And I was wondering if anyone knew the reason for that.
Well, maybe we can talk about that the next meeting too.
Yeah.
Looking at educational equivalency, and if we are looking at K-CREP as a accrediting body, maybe we could reevaluate what does constitute educational equivalency as comparing to what K-CREP is currently requiring.
Perfect.
Like I
Does
said,
anybody need any clarification about what we're looking at here before we take it to the next meeting?
Is there a possibility of looking at other items on that 102-3-3A also?
I think that would be perfectly fine. This is the one item in particular that I want to take a look at, but I think if there's other items to review, I don't see an issue with that.
Sure. I'm just wondering about the in-residence one, which is just a couple above that.
Well, and I think there are some changes that are working their way through the pipeline right now. And so there has been previous discussion about the requirement of the in-residence hours, and that is currently being worked on. It's going back and forth in the Attorney General's office and getting close to be available for public comments. There are some changes already to this that are out there. So,
Okay, that's what I was wondering, because I thought we'd discussed that issue.
Yes, you
several
did. And
times.
now it's going to allow televideo if they're face to face
Okay, good,
for in residence.
Synchronous, yeah.
thanks.
I think there's a little bit of overlap here with what we were discussing before with this one in terms of a person's identity as a professional counselor. So they may come from a program where that identity is not necessarily emphasized. And so we're talking about the importance of that in postgraduate supervision.
So before we adjourn, I did want to get input from you, see if this time moving forward to the next calendar year would be a time in a day that would make sense to you all, or still be a good time to meet. And if so, I could go ahead and start scheduling those meetings into the next year. I just wanted to check with you before I went ahead and schedule them.
Did you hear back from Andrew Secor and from Adil Torres-Riera about their availability for the same time?
I asked Andrew, at this point, he said he does not believe that would be a conflict, but he does not know all of his schedule for the next year.
Okay. And about it, you haven't heard back from Adil. Did you ask Adil?
I don't believe I checked in with him.
Okay. So anybody have any conflicts you know of at this time? Okay, well, good. Hopefully this time will work. And if not, we can always doodle pro a new option. So unless we hear anything else, we'll consider this time our ongoing meeting time and date for next, or days for next year. Okay, I thank you, David, for that. Our next meeting will be December 4th at the same time. And I need a motion to adjourn.
Motion to adjourn.
Thank you so much. I need a second. Okay, I saw Bob's. Okay. Anybody opposed? Okay, I'm going to consider that an all yay adjournment, and we will see you in December. Thank you so much for your time today.
Thank you.
Everyone,
Thanks,
have a great one.
Here, you too.